My name's David Albrecht, and I'm an internal medicine physician. I've been working at Metro for 10 years. I've always wanted to be a physician. It's always been a dream, aspiration to help people. I have a special affection for helping patients in chronic disease and helping them to navigate a very sometimes complicated healthcare system. We take that very seriously at Metro, to be your advocate. With Deanna, when I met her, she was very, very sick. So she came into the office, a new patient to me, and we took a good history, we listened well. She was extremely short of breath, and walking down the road, going to the mailbox, walking into her house, she couldn't breathe. And it was worrying her. You could tell that she was very, very nervous and anxious about the symptoms that she was having. And so we came up with a very strategic plan. We told her exactly what we were gonna do. We were gonna do lab work, we were gonna do x-ray, we were gonna do an ultrasound on her heart and start treatment. So she had an echocardiogram. Her ejection fraction came back showing that her heart was weak. That was 35%. That's a significantly weak heart. And then we determined that she also had a significant valve problem. She had mitral regurgitation that likely required a surgical consultation. She also had anemia, a lower blood count. She also had to see a gastroenterologist. So it's very complicated. She has to go see a lot of different specialists to help manage the condition that she's dealing with. And it takes a team to really manage that and to follow that. But it all starts at the primary care office. The medical conditions that she was suffering were life-threatening. And there was a time there where we were worried that whether we could really save her and whether she would be well. The treatment was aggressive for months. And what was nice to watch is that she was getting better with the medications and surgery and treatment. It's a privilege as a physician to be able to restore hope. I love seeing her. She comes in with a smile on her face. She feels good. She can breathe. She can spend time with her family and her friends. One of the nicest things I think a patient's ever said to me is just simply thank you with a hug and knowing that I had an impact in her life to make her well.